I'll put myself on mute.
Thank you. And let me know if things start sounding wacky.
Okay.
So we'll go ahead and start the stream. Thank you for your interest and attention. The major theme for this is that it depends on what you're looking at. Some people are saying just recently, and the others were saying, you know, this has been out there for 4 days, and I think they're both true. The CDC is saying stock up. If you're 60 and older, if you have diabetes, heart disease, if you're susceptible, stock up and prepare to stay at home. We're going to talk about that. So this, again, titles Coronavirus, SARS-CoV-2, COVID-19, novel coronavirus, whatever you're calling it today. Again, CDC advice, stock up, stay at home. Now, one of the first questions is how long? And then what's next? And then we'll have some comments regarding zinc, quercetin, chloroquine versus hydrochloroquine, and you know, some other things too, like 70-year-olds and cruises. So again, as you know, the CDC is now saying, stock up and stay at home. And they're also saying, prepare for a lengthy stay. Now, people are saying, well, what does a lengthy stay mean? I can tell you this, it doesn't mean 2 weeks. I mean, if you have listened to the Joe Rogan Experience, and when I think it was Robert Osterholm, we'll cover him in a few minutes. He was saying it's going to be 2 to 3 months. I would agree. I think that's accurate. It's going to take a while. I mean, this disease is coming through quickly, far more quickly than most of the world expected. But we're also doing some things to effectively slow it down. You know, the NBA canceled all their events. March Madness has been canceled. A lot of things that were really going to amp up spread are starting to slow it down. And that's a good thing, because if they didn't, our infrastructure would be overwhelmed. The 60-year-olds, the diabetics, heart disease, lung disease, immunocompromised, we need to stay at home and let that thing ripple through the herd, the population. After we've created some things called herd immunity, then we're a lot safer. So, oh, and by the way, well, let me go back for just a second. I covered, now who is that? And why would I be covering that on a quote, heart attack and stroke prevention channel? We might actually have to change our theme a little bit, because again, we're focused on the things that are endangering our population. And speaking of which, if you look at our YouTube studio description of our population, 78% or 79% of our viewers are male. And sort of an unusual channel in terms of, that's not unusual, but the age distribution's pretty unusual. Over half of our folks are 55 years or older. And here's the next question. What portion of our folks are diabetic? Well, the definition of diabetic, at least for the CDC description, if you go and look at some of their videos, they're talking at least about severe diabetes. Well, I don't have severe diabetes, but I've been holed up for a little over a week. And I think that's not a bad idea right now. Now, we talked about diabetes, we talked about heart disease, we talked about being 60 and older. And we also mentioned Michael Osterholm and the Joe Rogan Experience, number 1439. What else? Here's one other item that he said. And a lot of our patients, over half of us, have had this. Many of us have lost it. But in terms of this risk factor, there are a series of risk factors that we worry about, that if they overlay on this disease, COVID-19 infection, they're going to cause bad outcomes. And we happen to be right at ground zero for one of the major risk factors, major ones in this country, and that is obesity. So again, if you have obesity right now, if that's one of your risk factors, consider whether or not you have special risk factor, because you do. Now, let me be clear about something. We're getting to the point to where the world is beginning to understand the gravity of this situation. And if you're not a public health person, you may be tempted to say, oh my gosh. And I've had several of these comments. Now I'm panicked, I'm terrified, this is scary. This is not the end of the world. This is it's a 100-year pandemic. It is a big deal. It's something that's unprecedented. We've had some of these in many of our lifetime, but it's something that just follow the directions, do the right stuff. We're going to be fine. It's a 100-year pandemic. We've been waiting for it. Those of us who work in this space. There's a book about it. Michael Osterholm. Dr. Osterholm has been involved in this kind of stuff for quite a while. I read the book Deadliest Enemy last night. It's a great book. Governments and businesses have gotten a lot of warning about this with SARS, with MERS. Actually go to chapter 13 of his book, and I will cover that in a minute on the next slide. Unfortunately, our preparation's been inadequate. We could have done some very different things to have much better mask availability, much better healthcare accessibility, much better vaccine research, much better social isolation plans. But you know what? Humans are notorious for, that's what prevention's all about. And that's what my life is all about. Humans are notorious for waiting till the tidal wave is here and then saying, wait a minute, what can I do? Waiting till the heart attack's here and saying, doc, fix me. Waiting till the stroke is here. Doc, fix me. So, that's just typical for the way we humans are. Now, that's okay. Again, no need for panic. We have a great countermeasure, just use it. It's called social distancing. And again, let the more immune generations take the first wave of this infection. The younger people, the folks that don't have susceptibility. Now, I mentioned I was going to go over Michael Osterholm's book for a second. I'm just going to spend one slide on it. It's chapter 13. And he said, coronavirus will come back. SARS and MERS, harbingers of things to come. And he starts it with the quote from Rudyard Kipling's book, Mandalay. And the dawn comes up like thunder out of China across the bay. Well, certainly did come up like thunder out of China across the bay, didn't it? Now, again, it's not just his book. His book covers plenty of other things. It's come from the CDC, it's come from the Lancet. And here's an article out. Here's some description of a couple of these things. In 2014, CDC study determined that over 125,000 people flew directly from Saudi Arabia and the UAE in a 2-month period to the United States. Now, any of those travelers could have been just like the 68-year-old man who returned to Middle East from South Korea carrying MERS. You see, MERS is still transmitting in Saudi Arabia. Now, wait a minute. What has MERS got to do with all this? Remember, MERS, SARS, and coronavirus, they're all in the coronavirus family. This has been going on with different strains of coronavirus, different types of coronavirus for years. We've known it was going to happen. We've warned our governments, we've warned ourselves, and instead we've focused on other things. Priorities happen. And it didn't make the priority list. It did now. In summer of 2016, the Samsung Medical Center, this was the medical center in South Korea that actually discovered and stopped, as well as they could, the first MERS problem. They were the team responsible for investigating and controlling the MERS outbreak at their institution published a detailed account of their efforts. and the lessons they learned in the medical journal Lancet. The final paragraph of that article provides a battle-weary conclusion and a voice of experience that the rest of the global healthcare community should take very seriously. And again, this is out of chapter 13 of Osterholm's book about SARS and guys that's coming back. Now, this is the Samsung Medical Center, the South Korean team that actually discovered the MERS, discovered the outbreak, managed it. And again, that was the coronavirus that was like 32 to 36% mortality rate. Here's what they had to say at the end of their article in the Lancet, a global medical journal. The potential for similar outbreaks anywhere in the world should be noted from a single traveler as long as MERS-CoV transmission continues in the Middle East. And it's still continuing. It's the thing that's found in camels. Camels are a big deal in the culture in that area. We're not going to get rid of camels, and it doesn't look like we're going to get rid of coronavirus in that population anytime soon. And in fact, if you look at control of coronaviruses, it's likely to be one of those one population type things where there's going to need to be, if it's a vaccine, it's going to be a vaccine that needs to happen for animals that carry it as well, especially ones like, well, anyway, I'm not going to go any further on that because I'm afraid people are going to misunderstand me. I'm talking public health and outbreak management here and prevention. Here, let me go back to their quotes. Emergency preparedness and vigilance are critical to prevent further large outbreaks in the future. Our report serves as an international alarm that preparedness in hospitals, laboratories, and government agencies is the key, not only for MERS-CoV infections, but also for other new emerging infectious diseases. So again, you see, a couple of years ago, 4 years ago, they talked about hospitals, they talked about laboratory preparedness, they talked about governmental preparedness, they talked about until transmission of MERS is no longer happening in the Middle East, and that hasn't stopped yet, that this is a major risk. So again, we didn't prepare, we had a warning, and that's not unusual for human beings. Now, to the point about how long will this be, again, this won't be 2 weeks. I think Osterholm gave an estimate on JRE about 2 to 3 months. And yeah, that's certainly, you know, he knows more about this than I do, but I had already figured that it was probably going to be about that long as well. So again, now that we are doing some things to slow the progression down in the younger, non-susceptible parts of the population, it's going to take longer, but again, that's a good thing because it's much less likely to create, you know, an Armageddon post-apocalyptic, you know, kind of emergency situation. It's much less likely to take out hospital systems, ICUs, other healthcare systems, laboratories, things like that. So all of us need to continue to follow that advice in terms of social isolation, and don't panic. We've heard it before. Again, you're only delaying the inevitable. I'm terrified. Don't go there. Don't panic. There's no need for it. Just don't give up. And again, follow the directions for a very good countermeasure, which we have available for us right now, and that's social distancing. We started talking about that last week, and they started talking about canceling March Madness. They started talking, whether they've already done it. They've already, NBA's canceled it. So a lot of our folks are now getting their head around, even non-public health folks are getting their head around this. Universities are closing, schools are closing. People are and the last one, like I mentioned earlier this week, closing schools was one of the most painful, and that's still going on in a lot of places. So my heart and prayers go out to the people that are involved in that piece, because that's disrupting a lot of kids, a lot of parents, and that's going to have ripple down effects on places like the hospitals. You know, again, maybe up to a third of nurses might be impacted if the schools close. Now, just a couple of other quick questions. We'll set it up for questions from outside. People have asked me about chloroquine versus chloroquine. Yes, there's some very interesting and hopeful information, evidence coming out from that. Hydrochloroquine probably be advantageous. Am I offering to write scripts now, or am I trying to get it? No, it's hopeful evidence, hopeful evidence. Zinc, quercetin, same thing, a lot of hopeful evidence. ACE inhibitors, an interesting story, but it's not very clear right now. Now, despite all of this lack of clarity in those and all this, quote, hopeful evidence, again, I can't help but just go back to the stark contrast. There's one item that we know it's not evidence. It works, and it's prevention as opposed to meager attempts at cure. Again, because humans tend to not prepare for something they haven't experienced yet. They tend to focus on, well, let me get a cure. What about chloroquine? What about zinc? What about ACE inhibitors? Think about, you see the tidal wave coming now. Think about, what can I do to prevent damage as opposed to trying to dig out of the damage? Social isolation, it works, do it. Now, what does that mean? Go remote. Groceries, can you get your groceries from Amazon? Can you get your groceries delivered some other place? They've been delivering groceries, over 30 years in Manhattan, but it's a much more recent type thing in a lot of places here. How about church? And I've shared a couple of times, I'm involved with my Sunday school and have been encouraging my church to reconsider just doing remote. And here's where we stand now. Here's where the group stands. They're saying, well, we're still planning on having Sunday big church, but not so much Sunday school. I still would rather see the whole thing go remote right now, for at least, remote availability for those of us who have significant risk. Over 60, obesity, diabetes. I would say pre-diabetes. And again, if you've watched any of the other videos on this channel, you would know that pre-diabetes covers a lot of people. It actually covers over half of adults, and not starting at age 60, but starting at age 30. Now, if you're a 30-year-old, 40-year-old with mild pre-diabetes, or you're at major risk, I haven't seen anybody say that. You're maybe a little bit more risk than someone who's 30 or 40 and doesn't have pre-diabetes. Healthcare. Half the potential patients, I saw a bunch of them. I talked with a bunch of people last week. I make phone calls to people who are interested or have questions about what we do and our services. And half of them still say, you know what, I'd love to have a preventive doc. And do you know any in my area? And I go, I don't know any others in my area, let alone your area. We're rare as hen's teeth, as my grandma used to say. Speaking of telemedicine, it's now law, and again, associated with coronavirus, to offer telemedicine where possible. So again, I would suggest to all of you baby boomers who are trying to wrap your head around telemedicine, remote means of medical care, start thinking a little bit more about it. It's a critical part for protecting your health right now. Now, again, we've already talked about this. This is an old video from earlier this week. I'm going to see if we can close out the show part and presentation part. Clyde, you'll if you would, take over that piece, and I'm going to start looking at, oh, here we go. Uh, okay, Z50 to Z6, Florida standing by or sitting by. Thank you. Starting in a minute. Is picking up prepaid Togos without entering a restaurant safe? I'm going to assume that's a joke. Is pick up as above equal to stock up? Well, or delivery? You know, again, it gets into questions about how to protect yourself when there are instructions out there available to what to do for packages as they come in as well. Janice Mulligan, thank you for taking the time to educate us. We need this. You're very welcome. Janice, thank you for your interest. In my area, some universities and schools are extending spring break until further notice. Most will have closed online, will have class online. I agree. A lot of them are still waiting till spring break. I personally think that's a mistake because again, what you're doing is you're allowing more amplified transmission up until the spring break period and then trying to slow it down. Again, like my grandma used to say, closing the door after the barn door after the horse is out. Parker Reed, good to hear from you, Parker. Just a quick FYI, despite the doom and gloom on CNBC, the markets are back up today. Well, that is interesting. You're right. The markets have taken a major hit. But again, I went there a little bit last time in terms of saying, I'll stick my neck out as an economist and say, look, the bull market was long in the tooth already. It was looking for a good reason. And what better reason than 100-year pandemic? Also, con calls with Asia confirmed factories in China are back up to 75% capacity in many cases. Now, in many cases, I wonder what that means. That is very interesting, Parker, because you know, you get this information back from the Chinese government. Oh, we're up and running. Well, what does that mean? Are they did they do it too early? Has transmission actually stabilized in China? Because I have to tell you, I'm a little bit skeptical that it has. I think this is a little bit early for them to do that and then still not see transmission ramp up again. Now, if they're opening skeleton crew in 10% of their factories, then again, they don't have a huge amount of, you know, a much lower potential for transmission. But you say 95% capacity? That's a surprise. But then you say selected factories. So again, it's very, very interesting question. Side question. Have you seen the new book, Mastering Diabetes? No, I haven't, but it's a great question. Obviously, diabetes is a big, big issue for many of us. James Cantor, your blood sugar is under control. 5.4% is being a diabetic still a problem. Oh, if your blood sugar is under control and your hemoglobin A1C is 5.4%, is diabetes still a problem? It's still a problem in terms, you know, the higher it is, the bigger the problem. So no, James, I mean, you've shared with the group many, many times that you're diabetic and you're doing a great job if you've got your blood sugar, your hemoglobin A1C down at 5.4%. One of the things I would say is, you know, I would also question what are your Libre or your freestyle blood stick numbers. Are you staying below 140? Because it's when you spend hour after hour over 140 that you damage tissues. You damage the endothelium of your arteries. Now, how does that translate to risk to your immune system and the risk that we're talking about today with novel coronavirus? I don't think anybody knows yet. It's a good question. I think we could all assume, but I don't think we know. There may actually be science out there which shows the impact of blood sugar levels on the immune system function. And in reality, with immune system function in general, yes, I do think it's the better control you've got, the better the better control you've got, the less risk you have. Clearly, I don't think there's anything out there to tell us about risk specific to COVID-19. James Cantor, yes, below 140 milligrams at all times. Excellent. You're doing a great job. And I have plenty of full-blown diabetics that are doing exactly that. They're staying below 140, 120 on a regular basis. And most of them are doing it mostly with diet and other lifestyle issues. Most of them are taking metformin. A lot of them are taking pioglitazone as well. Actually, very few are taking insulin. Parker Reed, my engineering teams are in Taiwan and Japan. We're reliant on China factories. Well, that is some very interesting information, Parker. Curious about what kind of factories and how reliant you are, and how much that reflects the rest of the Chinese production population. Didn't plan on having a long conversation today. I greatly appreciate the interest that we've had, and I'm going to close on out so we can all get groceries and stay home.